Can you get pregnant on your period? It's a question many people ask, and the answer might surprise you. While it's less likely, it's not impossible. Today, we'll explain how pregnancy during your period can happen, what increases your chances, and when to see a doctor. Let's get started. Can you get pregnant on your period, and when to see a doctor? 1. How pregnancy happens. To understand whether you can get pregnant on your period, it helps to know how the menstrual cycle works. The cycle is usually about 28 days long, with ovulation, when an egg is released, happening around day 14. Here's how it breaks down. Menstrual phase, days 1 to 5. This is when you're bleeding. The lining of your uterus is shedding and your body is preparing for the next cycle. Ovulation phase, around day 14. This is when you're most fertile. The egg is released and can be fertilized for about 12 to 24 hours. Luteal phase, days 15 to 28. If no fertilization occurs, hormone levels drop and your period starts again. Theoretically, it's unlikely you'll get pregnant during your period because ovulation is still a week or more away. But in real life, things aren't always that simple. 2. Can you get pregnant on your period? The answer is yes, it's possible. Here's how. 1. Short menstrual cycles. If your cycle is shorter than 21 days, you may ovulate just a few days after your period ends. Sperm can live inside your body for up to 5 days, so it's possible for sperm from period sex to fertilize an egg. 2. Miscalculating your cycle. If your period is irregular, it's harder to predict when you'll ovulate, increasing the chance of pregnancy. 3. Spotting or mid-cycle bleeding. Sometimes what seems like a period is actually spotting during ovulation, which is a highly fertile time. While it's less likely to get pregnant during your period, it's not a reliable form of birth control. 3. How to reduce the risk. If you want to avoid pregnancy, the safest approach is to use contraception, even during your period. Here are some effective options. 1. Condoms. Protect against pregnancy and sexually transmitted infections. 2. Birth control pills. Help regulate your cycle and prevent ovulation. 3. IUDs, one of the most reliable long-term birth control methods. 4. Emergency contraception. If you've had unprotected sex, emergency contraception can reduce the risk of pregnancy if taken within 72 hours. Talk to your doctor about the best birth control option for you, especially if your cycle is irregular. 4. When to see a doctor. So when should you consult a doctor? Here are some situations where medical advice is essential. If you're worried about pregnancy after unprotected sex, if your period is irregular or missing altogether, if you experience unusual bleeding between periods, which could indicate a hormonal issue or infection, if you're trying to get pregnant but struggling, your doctor can help assess your fertility and offer guidance. It's always better to ask for advice if you're unsure. Your doctor is there to help. Early pregnancy signs. If you think you might be pregnant, watch for these early signs. Missed period, nausea or vomiting, morning sickness, breast tenderness, fatigue and mood changes. Take a pregnancy test if you notice these symptoms, especially if you've had unprotected sex during your cycle. Final thoughts. So can you get pregnant on your period? Yes, it's possible, especially if your cycle is short or irregular. If you want to avoid pregnancy, use contraception consistently and don't hesitate to consult your doctor if you have questions. Take care of your reproductive health.